In tonight's health news, how to avoid the flu. It's been hitting San Diego County lately with a vengeance, and really the past few years as well. Last year hitting the highest flu-related death toll ever. And more people are also getting the flu now, with cases up more than 100% from last year. Dr. Mitchel Goldman from UCSD is joining us now on ways to not just avoid it, but kind of enlighten us, because you say in the last 3 weeks is when we've seen it appear here in San Diego, and we haven't even reached our peak yet.
No, we're still on the cusp. It's getting worse and worse every week. You know, all around the country there have been a lot of cases of flu, and this year's flu, which is covered or prevented by the flu vaccine, has already hit the rest of the country, but it's just hitting San Diego and California now.
And why is that? Is that due to our climate?
It's due to our climate, and also due to the fact that it just spreads gradually across the country. But it's really hitting hard now. You know, even my partner was just admitted to the hospital today. I had patients with the flu last week admitted to the hospital, so we're all starting to see it right now. And
you say hospitals are even curbing back on the visitors they're allowing because they're so packed and they're trying to keep it from spreading. Let's talk about the symptoms of the flu, because are they getting overlooked and we're letting it progress too far before we get checked?
I think so, because normally when you have a cough and a cold and a runny nose, it's one thing. But if you start having fevers at the same time, if you've got a lot of body aches, a lot of headaches, that's when you have to go to your doctor, because you may have the flu at that point. But also when you have those kinds of symptoms, don't go to work, don't go to school, because you're just going to transfer it to people that have not had the flu vaccine.
And a lot of people would say, hey, I don't have sick days. So it really has a lot of levels that people, one of the reasons that they force themselves to go to work. What are some of the common sense ways we can avoid it if we haven't gotten the flu vaccine?
Well, of course, the most common sense way is wash your hands. And, you know, as a physician, I'm washing my hands about 100 times a day. But we should always wash our hands when we're touching things in public. Also, if you're around the office or at home, clean off all of the telephones, doorknobs with an alcohol-based cleanser, because that's the best way to get rid of flu germs. If you do have a cough, don't cough in someone's face or your hand, cough in your sleeve. You know, just common sense types of thing. But most important is keeping your hands clean, keep your hands off your face, because that's how you're going to transfer flu virus.
And you say it's not too late to get the flu vaccine now.
No, and this flu vaccine is here in San Diego. You can get it from your pharmacist as well as your doctor, but it's never too late to get the flu vaccine, because we haven't peaked yet. It's still going to be another 2-3 weeks before we peak.
And who in particular needs to really watch out for the flu, because some groups are more at risk than others?
Yes, pregnant women, elderly over 70 years old, and then kids less than 1. Those are the populations where if they get the flu, it's going to be really, really dangerous. But you know, we're seeing the flu at the highest rate in people between the ages of 18 and 30. So it's the sort of young adults that are really getting it as well now.
Well, and a lot of times, let's face it, they're young working people that are kind of running themselves into the ground, so maybe their immune systems are compromised.
And chicken soup can't hurt.
Certainly can't. Well, Dr. G, always good to see you. I will shake your hand because I got the vaccine.
Yes, me too. We both washed.
All right, some really timely advice. And Andrew, good advice to heed, especially you have little guys at home.
That's right. I will get my vaccine after the segment. That's okay. Is that an option for me? Good advice for everybody as we have a lot of things ahead of us here.